I'm Tiffany Huth, Chief Communication Officer at the Innovation and Value Initiative. Joining me today is Dr. Seth Seabury from USC Schaeffer Center and School of Pharmacy. Hi, Seth.
Hi, Tiffany.
Welcome.
Thank you for having me.
Yes. So let's jump right in. This month, we are celebrating, highlighting Mental Health Awareness Month. And I'd like to start our conversation off by asking you, what are the most critical gaps in understanding the value of treating people with a mental health condition or disorder? What are we missing?
One of the things that makes mental health challenging in this respect is the way it can affect all aspects of a person's life. People with chronic mental health challenges and behavioral health disorders can have any range of effects, including worse physical health, particularly in severe cases, a harder time maintaining healthy relationships, holding down a job or keeping a house. And so it can really affect all aspects of your life. But the way we typically value healthcare treatments and interventions is ill-equipped to deal with this. We typically look at whether or not some treatment is impacting clinical endpoints, or we look for cost savings, things like that. But we don't typically track these sort of whole person effects of the disease or disorder. So what we need to fully understand the value of treating mental health is to take a more holistic approach where we evaluate not just the clinical aspects, but we also track these downstream effects on a person's life and well-being.
Yeah. So what is the key thing that we need to do to address that?
I think just generally speaking, the biggest problem we're facing with mental health care right now is access. There are effective, validated treatments and interventions and services out there that can really help people. However, for many reasons, there are barriers that prevent people from accessing them, particularly the people who need them the most. Some of this is cost, lack of insurance coverage, but also a shortage of providers, both physicians or social service providers. Because of the whole person effects, there's a range of providers, not just in the healthcare system, that can help people. But most people, or at least a large number of people in the U.S., live in an area where there's a shortage of mental health care providers. And we need to do more to invest in both increasing the supply of healthcare and services available, but also doing more to connect people who could access those services to make sure they get them. This includes making it easier for providers to talk to each other. So your primary care provider able to talk to a mental health specialist or a social service provider, and then allowing people in the healthcare system to communicate better with people outside of the healthcare system. This would help connect people with services and also help us better track and monitor when people are getting the care that they need and to evaluate the impact on their lives. And that would help us to do a better job of assessing the value of the care that's being provided and make the case for investing in getting more care to more people.
Seth, thank you so much for your insight today.
Thank you for having me.
I encourage everyone to visit the Schaeffer Center website to learn more about the great work that Seth and his colleagues are doing. Thank you.